you?
I'm good. How are you?
Good. My name's Madison. I'm going to be your student nurse today. I'm just here to do a quick head-to-toe assessment for you. It's going to take about 15 minutes. Is that okay with you?
That's fine. Yeah.
All right. Sounds good. You go ahead and just verify your name and date of birth for me.
My name's Kristen. July 22nd, 1993.
Great. And Kristen, why are you here today?
Yeah, I just don't feel well.
You don't feel well?
Mm-hmm.
I'm sorry to hear that. And can you tell me where you are?
Yeah, I'm in Loyola Med Center.
Medical Center. And what month is it?
It's April.
It's April. Great. Well, by those checks, our client is alert and oriented times 4. Can you go ahead and verbalize your height and weight for me?
I'm 5'5" and about 200 pounds.
5'5" and 200 pounds. Client is within the healthy BMI range. And then do you have any allergies?
No.
No allergies, that's great. And then when the client walked into the room, I did observe that she had a steady gait even, no obvious physical deformities that I can see. She has a skin tone that's consistent with her ethnicity. She also appears not to be in distress. She has a overall pleasant demeanor. She's dressed appropriately for the weather, and her personal hygiene appears good as well. And then, Kristen, if you're in any pain today, on a scale from 0 being the least pain you've ever felt to 10 being the most pain you've ever felt, where would you rate your pain today?
0.
0 out of 10. Love to hear that. Right, so we're going to go ahead and get started on the actual assessment now. Just going to grab a pair of gloves. Okay, and I'm just going to start at the head and work my way down for you, okay? Go ahead and get comfortable, whatever's most comfortable for you. Awesome. All right, Kristen. So observing the client's head, it is normal cephalic. Her hair is clean, it's brown and straight. The scalp is clean with no lacerations. I don't feel any bumps or masses on the head either, which is lovely. Great. I also don't observe any patterns of hair loss or alopecia. I am going to move on to your eyes now. It looks like the client's eyebrows are even and symmetrical, as well as her eyes, which are in line with the tops of her ears. The eyebrows move symmetrically. Blinking is unlabored. Eyes close all the way. Eyes are blue. The sclera is white. They look clear and healthy. Do you mind taking your glasses off for me?
Yep.
We're just going to go ahead and do a quick assessment of your pupil reflexes. So would you mind look at me and then follow this pen with your eyes? Awesome. And then I'm going to go ahead and shine a light in your eyes, okay? Right. Great. So pupils are equal, round, reactive to light, and accommodating. You can go ahead and put your glasses back on. Thank you. Moving on to your ears here. The ears appear that there's no skin breakdown. They appear clean. There's no drainage in there either. Do you do anything for work that is super loud or could be irritating to your hearing?
No.
Nothing? All right. And then do you have any hearing loss or wear any assistive hearing devices?
No.
Right. And then how do you clean your ears?
Just with a Q-tip.
With a Q-tip? Yeah.
But nothing inside.
Nothing inside the ears. See, that's what we like to hear. Great. Would you go ahead and tilt your head back for me? Nose is midline with the face. Looking on the inside, nares are pink and clear of drainage. I don't see the septum, so there's no deviation. Will you put your finger on one side of your nose and just breathe in for me? Great. Do it on the other side. Some areas are patent and clear. I don't hear any struggling with breathing. And I'm going to check the mouth. Lips appear to be healthy, no cracks or dryness. Can you smile for me? Great. Smile is symmetrical. Both sides of the mouth move up at the same time. Go ahead and open it for me. Awesome. Teeth are uncracked. Mucosa is pink and moist. You stick out your tongue and say ah. Soft palate is healthy. I see that the uvula went up and down, which means that we've got intact movement there. Moving down here, I see that the trachea is midline with the head as well. There's no deviation. And then I'm going to just check your range of motion of your head. So would you put your head to one side? Put your head to the other side? Put it back? Put it forward? Great. And then go ahead and shrug your shoulders up against my hands. Awesome. Good job. Client has full range of motion and strength in the neck and shoulders. I'm going to go ahead and check the arms now. Temperature is even and warm throughout. Skin is dry. Hair pattern and distribution is normal. The skin color is also consistent all the way down. I see that there are a few macula on the arms, which is totally expected, and there is a tattoo on the forearm of the left arm. I think that's left. I'm going to go ahead and check check for your blood perfusion in your fingers now. You go ahead and flip over like this for me. Awesome, get that one. Okay, capillary refill is less than 2 seconds, which is great. And then can you go ahead and just put your fingers together like this for me? Awesome, I see that little diamond in there, so there's no clubbing, which means that there's no hypoxia in the area. And then can you stick your hands out like this? Go ahead and turn your hands in, turn them out, palms up, palms back down, spread your fingers out, wiggle them a little bit. Awesome. I'm going to test your strength too, so go ahead and just put your hands against mine and push. Great, and put your arms like this. Yeah. And then pull back. Great. Okay, so client has +5 strength on both sides, and I'm going to just check the pulses on either side here. Go ahead and go like that for me. Okay, pulses are +2 bilaterally. I'm actually going to go back and check the carotid pulse as well. I'm just going to touch your neck. All right. Pulses are +2 bilaterally and even and regular. And now we're going to go ahead and move on to your breathing. I did notice that the client's breathing was unlabored, even. It looks easy. So I'm going to go ahead and take a listen now. I'm going to assess all of the lung fields, starting at the front, and I'm going to move to the sides and then to the back. All right. And normally I would be doing this under the gown, but of course for this purposes, we're going to have the client keep their shirt on. Just take nice, even deep breaths for me. There we go. So I'm going to move around to the back here. Thank you. On the sides here, one more. Some. Great. And I didn't hear any adventitious breast sounds. Breasts were even and unlabored. And we're actually going to move on to your heart sounds now. Great.
Sounds good.
All right. So I'm going to be checking the 5 points on the heart, starting with the aortic valve, moving over to the pulmonic, then down to Erb's point, the tricuspid, and then the mitral valve, or the point of maximal impulse at the apex of the heart. Right. Sorry, I'm just going to come in right here. Awesome. All right, I didn't hear any murmurs or bruit or any adventitious heart sounds either. The heartbeats are regular and even. And then we're going to just move on to abdomen inspection. So would you go ahead and lay back for me? Thank you, Kristen. And so normally I would assess the skin and everything, but since for the purposes of this, I'm just going to leave the shirt down. So I would note that the client's abdomen is even, rounded, has a consistent skin color with the rest of the body. There are no markings or lacerations or bruising in the area. And then do you have any pain in your abdominal area?
No.
No? And then when was your last bowel movement?
This morning.
This morning? When was the last time you ate?
This morning.
This morning, great. And then when was the last time you urinated?
This morning.
This morning, okay. Do you have to urinate right now?
No.
Okay, good. I'm going to go ahead and listen to all 4 quadrants of the bowels. I didn't hear any abnormal sounds there. It seems like normal bowel activity. And I'm gonna go ahead and push around on your stomach, okay? I'm just gonna gently palpate the area, feeling for any tenderness. Do you feel any pain when I do this?
No.
Feeling for any tenderness, any guarding, any masses, or any rigidity in the abdomen? Some? Okay. I don't feel anything, so that feels great, good. And now we're gonna move on to your legs. Would you mind sitting back up for me? Thank you. Okay, and again, client is dressed appropriately for the weather today. It's kind of cold, so she's got pants on, so I'm just gonna go ahead and say that the client does have an even skin tone all the way down, no abnormal patterns of hair loss. The skin temperature is warm and dry, and the joints do not look inflamed. There's no erythema or edema at the joint spaces, so they look healthy. Can you go ahead and do a quick push your knees up for me? Sort of extend your legs out, yeah, and then put them back down. And then can you point your feet towards the ground? Point them up, point them out, point them back in. Rotate your ankles a little bit. Perfect. Climate's full range of motion of all of the joints. And we're going to do a little strength test too. You point your toes down into my hands. Nice. And up into my hands. Good job. Push out towards my hands. And then push in towards my hands. Right. Try to lift your legs up here. Great. And then push back. Good job. Right, so a client has even strength bilaterally on both the legs. I am going to palpate the dorsalis pedis pulse. Normally the client wouldn't be wearing shoes. Obviously she is wearing shoes. But I would expect to find the dorsalis pedis pulse right here on the top of the foot and note that they are +2 bilaterally. You can go ahead and lay back and get comfortable. We're actually all done. I'm going to go ahead and perform my safety checks here. Patient's call light is right above the bed whenever they need it. The railings, I'm going to put just one up to keep them safe. Bed is in the lowest position. It is locked. Do you need anything else before I go?
No, I'm good.
All right, well, thank you so much, Kristen. I'll be back. And I'm going to perform hand hygiene on my way out.